Imagine you're at your home, standing at the top of your stairs, looking down, and all of a sudden you lose your balance. And as you're tumbling and your heart is racing and you strike the floor and the pain is creeping in, you realize you're home alone. This would be scary for anyone at any age, and it became a reality for me at the age of 30, when I returned home from the hospital after having both my knees operated on at the same time, and I came to these 3 stairs. And I realized I couldn't figure out how to get into my own home safely. And I had this tremendous fear of falling the entire recovery that I just couldn't shake. It was life-changing for me. As a former college athlete, I always thought I would go into a career in sports medicine. I wanted to help athletes stay active. But after this experience, I changed my path, and I'm now an orthopedic trauma surgeon and geriatric orthopedic trauma surgeon at The Ohio State University. But that fear of falling continues to motivate me, and I have a new goal. I want to help others stay safe in their own homes for as long as they desire. Falls can be catastrophic, and they can lead to severe injury and even death. Every 19 minutes, an older adult dies from a fall. $55 billion will be spent in 2020 for falls. And 80% of falls that happen will occur in a person's own home. As healthcare providers, we have no idea what the homes of the most vulnerable patients look like. There's lots of solutions. We have great preventative techniques. We know that balance training and strength training and home modifications can be very effective. The problem is, as health providers, again, we have no idea what those houses look like. And 50% of older adults don't even talk to their own doctors about a fall they've had in the past year, nor their family members. So we conducted a study to try to figure out why people don't talk about this. And I think one person summed it up really nice. They said, falls are embarrassing. I mean, think about it. Falls are embarrassing at any age. But for an older adult to admit they're having a fall, they might have to leave their home. It's critical that we begin to start having conversations and get rid of the stigma of falls so that we can come up with bold solutions. As a surgical fellow in Minnesota, we were approached by some paramedics who said they had this problem they wanted our help with. They told us that there was 911 falls coming in where they would go to the patient's house and they would find them on the floor. And they'd pick them up and put them in a position of safety. And then they didn't need to take them to the hospital because they weren't hurt. But even as they were leaving their homes, they were frustrated because they realized they didn't solve anything that led to that fall in the first place. They knew they'd probably be back out there in the next few days or even the next few hours. I'd really never heard of anything like this. And I thought, well, that's really interesting. Let's take a little bit deeper look. So we looked at their fall calls over a 10-year span to see what was happening. And with an aging population, just as we expected, the fall calls were going up. But the transport rate to the hospital was actually going down. And instead, we found this new phenomenon where there's this dramatic increase in lift assists. Lift assists are expensive. They divert care away from emergency situations. It costs anywhere between $800 to $1,500 per run, and this isn't reimbursed by health insurance companies. And the reason there's such a gap, $800 to $1,500, is because it costs about $800 to send an ambulance with 2 people on to help with a fall. But they've had so many emergency responders get injured that now most communities send a fire truck with 4 people because it's more cost effective to not have someone get injured and less likely for them to need to transport them to the hospital. 30% of the people who called 911 called again. 1% of the people who called 911 called more than 10 times. One person even called 75 times. And every time they called, they were less likely to need transported to the hospital. I was fascinated by this data, and I was also intrigued because the paramedics had a different lens than a lot of the healthcare providers in the hospital. They get to look and listen and feel for the environment of these patients. So when I moved back to Ohio, I was really excited to maybe tackle this and maybe find ways that we can leverage 911 fall calls to activate resources and put safety things in place. But I was also overwhelmed. I was about to start a surgical practice, and I didn't think I could do such a big problem by myself. Have you ever wished you could clone yourself? Luckily for me, I was born with a great identical twin sister who also happens to be a great physical therapist and researcher, whose expertise is taking evidence into practice and making impactful change. We were really excited to tackle this topic together. And just by happenstance, there was an art festival going on in Upper Arlington that very same week. And we ran into a group of paramedics who were also very interested in tackling falls. But they were worried too because they knew it was a hard topic. And many of their peers had said, it's too hard to start with community paramedicine at that. Pick something easier. It'll be safer. But they felt they couldn't ignore falls. They had too many in their community. So we thought it would be an awesome opportunity to start to collaborate together. So then we walked in each other's shoes. They came to the operating room and walked around the hospital. We went on lift assists. They even made my sister Katie go down the fire pole. But we also realized this was bigger than us, and we needed more help. We needed a bigger brain trust. So we met together frequently and designed a group called Community Fit, or Fall Intervention Team. We describe ourselves as an agnostic group of gritty people focused on fixing the gap in fall prevention. We even have a motto: steal shamelessly, share seamlessly. Because if we're going to come up with solutions, it's important that we break down the barriers and break down the communities and come together to come up with bold solutions. It takes a lot of funding to carry out exercises like this. We were really fortunate to be funded by government and foundational funds and even private donors. And the collaboration is growing with so many names I can't name today. But thank you to everybody who's been involved so far. We even thought we have a great idea for what we can tackle first. We know that home modifications can be very, very, very powerful. So we thought we'd start there. And we thought, well, maybe we can start to do home modifications for free for the people who need it most. We were excited. We got grab bars and lighting, and we waited for that first 911 call. And when the first one came in and we were ready to stage it, we called for a handy person. And they said it was going to cost about $500 to bring someone in to put grab bars. Immediately, we realized this would be too big of a barrier. We wouldn't be able to help very many people with that. So we went back to the drawing board. And as we were talking, the firefighter said, well, hey, we do fire prevention all the time. We put smoke alarms in people's houses. Why can't we do the same thing with grab bars? So they went to their legal department and they obtained legal waivers so they could start to do grab bars. To date, the Upper Arlington Fire Division has installed 220 grab bars at no charge to the residents for less than $125 per house. Pretty awesome. And people are very excited about this. And as we were going through this, we thought maybe the costs were the biggest barrier. But actually, on Cyber Monday, I went to Amazon and I Googled grab bars. And I had greater than 10,000 hits. Great deals, but 10,000 hits. Which one do you choose? Where do you put it? Who's going to install it? These would be hard decisions for anybody, but for an older adult that's afraid to even admit out loud that they're having trouble, it's overwhelming. So this is what happens when you activate 911 fall calls to leverage resources in a community. The data in the red is data before the community paramedicine program started. The data in the green is after. There was a 65% drop in fall calls in the community. 65%. I've never seen anything like that. And the Upper Arlington group had a big goal as well. They wanted to decrease the transport rates to the hospital because they felt like if they were decreasing the transport rates, they would have less serious injuries that they were encountering. So again, this is the data before in red. This is the data after. They had a 58% drop in transport rates to the hospital. And it gets even better. So if you look at the dots and the up and down represents each month for how many times they were transporting to the hospital. And as they get better and better and better, if you look at the last few months, we're getting so good at predicting who needs resources and getting those in place. And the word is spreading, and everybody's super excited. We're growing and growing. This is a picture of the firefighters and paramedics training each other how to put grab bars in. This happened last month. Fake drywall, fake tile, fake pipes and wires so that they can get it perfectly. So when I first started down this journey of falls, I never really thought that a fall could save a life. But in some ways, I feel like it saved mine. I love my job, working with family and friends in the community and making impactful change. So my challenge to you is, what fall or failure or life experience have you had that you can leverage to activate resources within your own community to make impactful change, maybe even save lives? Thank you.